Welcome back, everybody. Now, the marking of matric exams begins today. This amidst the second wave of COVID-19 infections. The Department of Education has made many adjustments to the way marking normally happens in order to keep everyone safe. But both the teachers who are marking and some of the unions are still concerned. Joining us now to discuss this are Basil Manuel, the Executive Director of the National Professional Teachers Union of South Africa, or NAPTOSA, as well as Mugwena Maluleke, the General Secretary of the South African Democratic Teachers Union, or SADTU. Gentlemen, a very good morning to you. Thanks for joining us and a warm welcome to Morning Live. Happy New Year to both of you.
Good morning.
Good morning. Pleasure to be with you.
Indeed. Now, Mr. Maluleke, I'm going to start with you. Before we get into details, let's get a brief response from SADTU. Just briefly, you say that you are reasonably satisfied with what the department has done?
Well, we are saying that with the consultation that we have had, we've been able to improve on a number of areas that we were not happy with. And clearly it is that with any other regulation or any protocol, it all depends on our attitude in terms of how we implement those particular regulations. To the extent that the department has been able to increase the marking centers and making sure that every marking center is linked to the Department of Health by providing either private or public healthcare worker that would then be assisting us. That is an improvement from what we were experiencing in 2020 when schools were involved in the first wave of the pandemic. And therefore, to that extent, therefore, we are saying that it is only going to depend on the markers and any other official who is going to be at that center to follow all the protocols as required, because they are on the paper. And if our attitude is that, well, we can always take off our masks, we can always chart and all those particular things, those particular protocols and any regulation is not going to work. We have seen it in our country where we were taken to level 1 and people started partying. And therefore, marking is a very sensitive matter. It's of national interest. And therefore, it's important that everyone who is there, even visitors who are allowed to be there, they've got to take those particular precautions. Screening, which is 3 times, especially for hostel. Of course, we have to be acknowledging and commending the department for doing that and so forth. Of course, we'll always have those particular areas that we're concerned about, but we can work together so that we don't sensationalize any other issue except to say this is in the best interest of our people, it's the best interest of our country and our children. And that is what is very critical for us to look at. Yes, there will always be weaknesses, and those weaknesses must then be addressed. We must be transparent, and we must be able to assist and support our teachers.
One of the regulations, Mr. Maluleke, is that the marking venues should not exceed 50% capacity, and the markers as well as the officials must adhere to the social distancing. So will this not perhaps delay the marking process? And what are some of the contingency measures that have been put in place to ensure that the same turnaround time is achieved?
Well, what has happened is that the increase in the number of marking centers address that particular issue of the numbers, because social distance is one of the most fundamental requirements for cutting the chain of the spread of this particular virus. And therefore, the department has gone into a process of increasing the marking centers. For example, in Gauteng, we're now having 35 marking centers. That in itself says we'll have got more people that are in those marking centers, but in any particular marking center, at any particular point, we will have got less people. So it means that we'll have less than 50%, not only 50%, but might have less than 50%. For example, in areas where you cannot have more than 50 people in one particular area, you need to stick to that so that we do that. So the issue of the duration, the issue of the timelines that have been set, the contingencies are in place in making sure, should it happen that one center is being closed, there has been another satellite that has been identified to immediately be utilized for that. For example, if there's contamination, decontamination that must happen in one center, the other center will have to kick in with those that are not affected, because where there are markings, where there are regulations, we have seen that there are less infections because people are adhering, unlike when people are in a party or something else where you cannot control. But where there's hard controlling of this thing, then it can. So contingency plans are there in the regulation. regulations, and we believe that if we follow that, we can stick to the marking. Of course, there are uncertainties, and we must accept and also appreciate and accommodate that if there's going to be a delay of 1 day or 2 days in terms of giving the results, the higher education institution are part of this particular process, and therefore they will also be able to appreciate the fact that the higher education institution will have to shift their days of accepting or admitting our students. But we are crossing our fingers that we work together as a nation in order to ensure that the timelines that are there are being able to be kept. But obviously, the virus is unpredictable, and what would happen is that we're not hoping that we can close as many centers as the virus is beginning to be very brutal to our people. Clearly, is that we cannot risk the lives. If there's going to be a center that must be stored, it must be closed. Yeah. And if we have got to delay by a day, we must delay by a day. But that must not be seen as being inefficient. It must be seen as saving the lives of the people.
Okay. Mr. Basil Manuel, let me also bring you into this conversation. NAPTOSA says the department has done a lot, but certain concerns still remain. Briefly take us through some of these concerns. What are they?
The concerns lie with the uncertainties that nobody can attend to before it actually happens. We are dependent on, of course, many officials doing the right thing. As Mugwena has said, we have a good protocol in place that has shown a certain amount of agility and adaptability and change and the willingness to do that. And that is important for us because we brought those things to the table and the department has shown its willingness to change. However, it's the proof of the pudding is in the eating. Now we want to see what have the provinces done, are all the protocols in place, and are they followed strictly every single day? Then, of course, we have our own members and the teachers in general who will be marking, and they too have to be part of that drive to ensure that everything is followed to the letter. If one person doesn't do the right thing, they potentially can infect everybody else. And of course, there are problems that are associated with the changes. The restriction in numbers does limit the number of people who can stay on site. So if you're not residential and you're traveling in and out, who are you coming into contact with? And that's where the discipline has to come in from the markers themselves, that they have to limit their circle. In fact, they should have no circle because they will be coming back into the marking center every day. And we don't want anybody coming in with something that could be potentially disastrous. Okay. And then, of course, if we do have a problem, we have to be agile enough to be able to address it. And as Mugwena said, one of the things that was demanded from the outset and the department acceded to that was the increase in the number of marking centers has increased phenomenally to more than double the number that we've had before, so that we reduce the number of people there. But those are all measures that are on paper and now they are being implemented, and how we work with that, the cleaning of surfaces, the checking of people when they're coming in, the regular checks of everybody, and also the responsibility of the individuals to declare if they are not feeling well. If these things are all met, we will have an incident-free marking center. But if we have a kink in the system, then of course we are going to have problems.
Is it likely, though, that NAPTOSA members who have signed up to mark will actually be in attendance, especially those who will start today?
Well, we certainly hope that everybody who has been appointed to mark will have given it sufficient thought, and those who have fallen ill or those who have tested positive will let us know ahead of time, that is the center managers, and they will withdraw so that they can be replaced. Then, of course, we have to acknowledge that some people have become much more fearful than they were a couple of weeks ago because of the second wave. And there may be some people that withdraw because of that. We hope that they've been responsible and have informed the relevant authorities so that replacements from the substitute list could be made. But yes, we've encouraged our members. We've said, if you follow everything to the letter and you hold the department to account, let us know if things are not in place so that we can intervene. And if all that is done, then we see no reason why you shouldn't be there to actually do your bit to mark. Remember, people have offered themselves to mark. It's a choice. And with that choice comes a responsibility. Those people with comorbidities, we've asked them to exercise their minds with this. Are they going to be safe safe enough? Are they comfortable with the safety measures that have been put into place? And then they must make a decision. But please don't just not arrive. Let us know so that we don't have any crisis that is starting at a marking centre.
Let's get into a little bit more detail, Mr. Maluleke. Which is the biggest area of concern for you and why?
Yeah, thanks for that particular question. Basically, is that what Manuel has really indicated? It is that the traveling to and fro from the centers and home, and when you have got these circles around you, our appeal together with NAPTOSA is very clear. Do not have circles. Do not be visiting. Rather be at home, and then you go to marking and you come back. Is for your best interest, is in the interest of your family, your community, and our country. So rather focus on that. And clearly it is that one of the most concerns is the issues of ventilation in those particular areas. We are clear that no air condition must be used. Rather use the opening of the windows, the opening of the doors, so that there's enough ventilation in those issues. And then we are also very clear around the issue of eating. That says let it be takeaways, because this thing of eating together, it means you're going to take off the mask, and that in itself is a danger. The issue of water, let everybody has his or her own bottle where they can then use that for them, not so that they don't exchange and touch a lot of tabs and all those particular things. So, but at the end of the day, it is up to the markers and the officials to really think about themselves, think about the communities, think about their families, and therefore take personal responsibility around that. So the concern that we have would be if the provinces are going to cut the corners, that is going to be very irresponsible, because the province must make sure that their sanitizers, their officials, their everything in place. And therefore, we're going to be monitoring as the unions, all of us, to making sure that those things are there. So these are some of the concerns that we will, as Manuel have said, we will only know when we are there during the marking, because what we have now is the paper that says to us, in this province, this is what has happened. In this province, this is what has happened. And clearly today we'll know who's going to arrive, who's not going to be arriving. And clearly it is that there's a substitute teacher, a substitute list, and the principals are responsible for that. And we're hoping that in the best interest of our country and the world, we will exercise caution. We will then be able to do it all as prescribed by the WHO, that we wash our hands throughout the marking, we sanitize through the marking, we ensure that when you are not feeling well, it doesn't matter. If you are not feeling well, just don't go.
Yes. Yes. And the department, as you may be aware, has introduced new protocols. So how are these protocols expected to assist the teachers when they are marking?
Well, yesterday on a Sunday, we have had at least one province that we have had a workshop where we called the department to come and workshop the markers to understand the protocol. But we have also said that the principals and the department must email some of those particular protocols to each and every marker, each and every official who is also involved in the marking on time. And when they arrive today, they will then be taken on board by the chief markers who are responsible for the center. Again, workshopping each and every element of the protocol, but also responding to questions to all those particular markers and all the other officials that are there. So that particular responsibility lies with the marking center and the manager that is there, and in particular, those that will be taking our markers on each and every question and each and every protocol. Where is water? Where are the sanitation? And so forth will then be workshopped throughout. But obviously the department has provided this particular regulation by Friday. They have been published. The link was there on the regulation, and we have done everything we can to ensure that we spread the message. We publish those things in our own platform so that all our members and all the teachers are able to access that.
Mr. Manuel, the department, as you may be aware, has radically increased the number of markers and added some locations. Do explain to us in greater detail, if you can, why this isn't such a simple undertaking.
Well, at first, let's acknowledge that it was an important concession to increase the number of markers for two reasons. Number one, to reduce pressure on marking. And number two, of course, to accommodate the fact that we have 1 million children who have written the exam. Not all of them are full-time candidates. Some of them are part-time candidates. Some of them are the June candidates. And so you needed more markers. But of course, you needed more centers. With more centers and no clustering of many subjects in one center, what you then have is that you have the markers spread out. And of course, the sheer number, you're not going to have centers that have 500 markers as in the past. And that will then, of course, result in a far greater control and, of course, a greater safety. Remember that there is a point where you've got to address markers as a group, as a large group, because you've got to go through the protocols, etc. And even that we've addressed to say this has to happen in much smaller numbers so that we don't have the close proximity of people one to another. And these are the issues that have become paramount to us. Everything is about health and safety. Mugwena has spoken about the water, has spoken about the fact that we need to see that everybody understands what the protocol is about. And the protocol, whilst it's inanimate, it's a piece of paper, it does spell out the responsibilities of each group. And we want every group to take their responsibility seriously. Only then will we see that these measures are actually working. But the measures of reduction, of increasing the number of marking centers and increasing the number of markers says that we'll be able to get through this within the given time, and also says that we are seriously taking into account the safety of our, not only our officials, not only our markers, but remember we also have the checkers that are there, the people who come in to check the marking, check the mark allocations, etc. They too are an important component. So every single group must be kept safe. Even the cleaning staff has to have that responsibility to ensure that when places are being cleaned, they too are being kept safe from the general things that are happening there. So many boxes have had to be ticked, and now we are reliant on those officials to see that there is nobody flouting the rules and regulations, which we have worked so hard on to ensure that they are there to keep everybody safe and healthy.
What then will happen should, God forbid, should a marking teacher get infected? I mean, what's the likelihood of one area becoming a small hotspot with many infections? Will that perhaps not delay the marking process and the issuing of the results?
We are adamant about this, that there are varying possibilities that could happen. We could see that somebody would come in and not know that they are positive, and then we have a scare. These are the realities of the unknown. And when that happens, of course, people have to be isolated. People will then have to step off the marking team. We have to then clean the place up properly, etc. And Mugwena did speak about alternate venues if there is a major outbreak. However, we also want to say that there are so many possibilities that we can't make an arrangement for until it happens, that we've got to accept that certain things will happen. Now, if somebody does test positive, remember, we have the backup teams. We have those people who are substitute markers. And depending on when it happens, they will be brought in. They've got to be trained too. So it is a delay. But the one thing we are absolute about is that we won't compromise on safety and health simply to meet the deadline. The deadline is important, but it's less important than the health and safety of all our people who are busy there. And if it results in a delay of a day, it's not the end of the world. It has always happened at marking centers that some teams go slower for various reasons when there are some glitches that happen. So we are not too concerned about this. And if it delays everything else by a day, it's not the end of the world. Everybody knows that we are in a situation which demands greater agility and adaptability of everybody. And this is what we want to bring home, not only to the greater marking community today, but also to the officials, is that the one thing can't compromise the other. And the bottom line is the lives, the health, and the safety of everybody in our marking centers, including our own monitors. Yes. And we have said to our monitors who will go there to also observe that they too must ensure that they are not in a circle so big that they become a danger to the others. Everybody must play the game with health and safety in mind.
Okay, we certainly hope that, the health and safety of the markers and the teachers will be of utmost priority. Because, I mean, if not, it will defeat the whole purpose. Mr. Basil Manuel and Mr. Mugwena Maluleke, thank you so much to you two gentlemen for joining us.
Thank you. Have a good day.